You're watching an RH Reality Check production brought to you by rhrealitycheck.org.
We have consistently ranked among the top 10 for AIDS case rates and other STD rates. Part of that is because our state is poor. Part of it is because much of our state is rural. Part of it is because our citizens just did not know their risk. We know that the South bears the brunt of the HIV epidemic. It has for a while now. And in general, although the South represents only 39% of the U.S. population, through 2006, an estimated 52% of all the persons that were reported living with HIV resided in the South. And if you look more closely to South Carolina, to the prevalence rates in our state, it's stark. In South Carolina in 2007, we ranked 8th among all U.S. states and the District of Columbia in AIDS case rates.
I want them to know that the face of HIV could be any face. It doesn't necessarily, there is no description of what an HIV positive person is, and that the help that's available needs to be available for everyone so that we all can live a fruitful life. I believe that most HIV positive people want to work and take care of themselves and not have to depend on the system to help them live okay. I guess what I'm trying to say is that we need a hand up and not a handout.
We also want Obama and his staff to understand that much of our state is a rural state. And this is really important in terms of the HIV/AIDS epidemic because it has a great impact on a person's individual access to health care, both primary and HIV specialty care. We have case managers in our state, HIV case managers, who some have 110 patients per caseload. And the recommended caseload is approximately 40 to 70 patients per case manager.
Living with HIV/AIDS in South Carolina, sometimes, most of the times, seems like being diagnosed in 1981. The stigma and the discrimination is still so thick here that sometimes it's heartbreaking that people are still uneducated, don't have the knowledge to know that this is a preventable disease and you can't get it from touching me or washing your clothes with mine, or just the crazy ways that they thought in 1981.
That's why it's very important. One of the other things that we want to ask for from the federal government are prevention funds to be able to once again do social marketing campaigns. Those social marketing campaigns are so important, and those funds have all but stopped now.
South Carolina seems to be standing still, and we need some advocates. We need some people to stand up and get out there and do the work to put South Carolina in the rural place, take the numbers down. We're in the top 10. We need to come down, and we've been in the top 10 for a long time.
Although African Americans only represent around 1/3 of our population, they bear the brunt of the infection, not just HIV, but STDs. And for HIV, 7 out of every 10 new infections are among African Americans in our state. We very much are excited about the visit from the newly formed White House on National AIDS Policy. They're coming to visit us, our city, and we're excited because it brings hope. It's a cause for hope because we're just delighted that we get to comment on what our needs are because they're great.